Yes, ma'am.
Okay.
Yes.
So good evening, everybody. As I've been introduced, I'm Professor Mrs. Bolajoko of Clinical Pharmacy, Faculty of Pharmacy, UNILAG. From our distribution, I'm presenting the first of the modules. I think we have about 30 modules from now till May 2025, I think. So I'm presenting module 1, which is titled Introduction to the Concept of Drug Information. And before I continue, the major source of this presentation, and which I think is what we have used to distribute everyone speaking from this module 1 till module 30, is this Drug Information, a guide for pharmacists, I think 7th edition by Malone et al. So like I said, there are 30 modules. So I'm starting with module 1, Introduction to the Concept of Drug Information. My outline, I'll be speaking, starting from introduction, then to definition of drug information services, drug information center, the skills needed, the major factors that influence the ability to provide drug information, then integration of information technology, and then practice opportunities for pharmacists. As for introduction, now, once there's availability of a patient and we're looking at a disease, and then we have medication-specific information, and of course, a knowledgeable decision maker. In this case, most likely a pharmacist. All these provide a system that supports the safe and appropriate use of medications in practice. So pharmacists can actually serve as leaders in the development of safe and effective medication use policies and processes. They can be involved in selection of drug information resources, even analysis and dissemination of medication-related information. Now we'll go to the different definitions of drug information. You know, the term drug information have different meanings to different people, depending on context in which it is used. And drug information actually covers a lot of questions, starting from identification, you know, of a drug, the cause, the pharmacokinetics, even up to the dosage and adverse effects. So based on these different meanings to different people, I have about 2, 3, or 4 definitions of drug information. The first one is that drug information is providing clinically relevant information on any aspect of drug use that is related to individual patient, or general information on how best to use drugs for population. In some clients, drug information means medication information and drug informatics. And in some clients, it's defined as the discovery, use, and management of information in the use of medication. Now, when we're looking at drug information, it may actually be associated with other words, such as specialist, practitioner, pharmacist, provider. And when we're looking at this association, then we're looking at a specific individual, which eventually will be maybe drug information specialist. Then it can also be associated with words like center, service, or practice. When we look at this, we're looking at a place like drug information center, providing drug information services. And then can also be linked to functions and skills. And when we're looking at function and skills, we're looking at activities and abilities of individuals to be able to provide drug information. Now, drug information is actually a fundamental responsibility of all pharmacists, no matter where you're practicing. We are responsible for drug information. And when we're looking at drug information, it may be patient-specific, or for a given, for a particular patient, or for a patient population, like maybe you want to provide information for diabetic patients, hypertensive patients together in a facility. Then it can also be, and then this drug information can be disseminated through multiple avenues, which can include presentations, publications, newsletters, even presenting this information on websites or even through social media. And the delivery can be face-to-face or by phone or email or online programs like Microsoft Teams, Zoom, Google Meet, like we're having Zoom meeting now. Excuse me. Sorry. Now, when we're looking at drug information, like I said, that can be provided face-to-face or through meetings, like using Google Meet, using Zoom. Then also, we can now talk about information center, drug information center, which as I explained earlier, that is a place, is attached to a place. So we can define drug information center as a place where drug information will be stored, retrieved, selected, even evaluated and disseminated by the specialist. And in this area, to the pharmacists, we specialize in providing information, or the public, or even to students. And the first drug information center was actually opened at University of Kentucky. That at that time, when the center was opened, it was drug information to staff, physicians, dentists, nurses, the drug information is the individual that is responsible for operating the center. And then it's also that the expectation is that the drug information will be stored in the center, retrieved, selected, evaluated, and eventually disseminated by the specialty in that drug information center. They will now look at drug information services. When we're looking at drug information services, when I was checking online, in some clients, it is expected that a pharmacist with PharmD will provide drug information services in the hospital or in a clinical pharmacy. And then for pharmacy practice, that is something like community practice, that it will be the drug information service will be provided by somebody that has a Bachelor of Pharmacy. But we know that in Nigeria, even if you have Bachelor of Pharmacy, you provide drug information services either in the hospital or in a clinical pharmacy setting, and even in pharmacy practice. And also, even if you have PharmD, you provide drug information service in pharmacy practice, that is in community practice. And when we're looking at drug information services, the term can be applied to any activity where information about drug use is transferred and includes patient-related aspects of a pharmaceutical care. And also, the primary goal of drug information service actually is to improve patient care by providing objective and unbiased information for drug-related questions. Now, when we are talking about drug information services, it involves a lot of services. But I'm just going to present a few in this during this presentation. And because others are still going to present as we go along, so since mine is just introduction, I'll just run through the different services, but details, you get details later when others are presenting somewhere along the line. So some of the services that are being provided include support to support clinical services with drug information when more research is required, to answer questions regarding medication from patients, caregivers, or even from patients themselves and healthcare professionals. And then this one will be dealt with into details when we get to Module 2 sometime this month, provided we don't change the date, because my own was changed to this day instead of last week Saturday due to some logistics. Now, also when we're talking about drug information services, can involve coordination of pharmacy and therapeutics committee activities. And in this one too, it is in Module 15, either in that book, Drug Information for Pharmacies, or even our own division, I'm sure we all have access to presentation timetable for this year, even up to next year. So somebody will talk more on coordinating pharmacy and therapeutics committee activity, week 15 or module 15 or chapter 15 in that book. Then part of the services also include developing and educating healthcare professionals on medication use policies. Then critical evaluation of literature to make formulary and patient-specific decisions. That is, there could be a class review, there could be review of drug monography, and this one we will find in modules 4 and 6. Then providing poison information, publish or editing information on appropriate medication use through newsletter, journals, websites, emails. This one will be dealt with in details in module 10 and then module 13. Then provide education for healthcare professionals, students, and patients. For instance, during in-service training, even in classes, even during experiential education, or even at journal club. This one will be dealt with in modules 9 and 13 to details. Then managing drug shortages. This one will be dealt with into details in module 17. And of course, to coordinate adverse drug event reporting and monitoring programs. This will be dealt with into details in module 19 and module 20. Now, like I said, this is not all. There are more than this, but I'm just giving this as examples as in part of our module 1, as part of our introduction to drug information. Now we'll look at benefits of drug information services. Actually, the major benefit is that it's going to be cost saving. And how will it be cost saving? It will be cost saving because it will decrease the need for monitoring. For example, instead of doing lab tests to monitor the progress of a particular drug or treatment, because some activities have been put in place that will curb any untoward effects, there won't be need for continuous monitoring. Then it also will be cost saving because it will decrease the need for additional treatment for adverse drug reaction. If we carry out our drug information services properly, we'll be able to, address or avoid or prevent adverse drug reactions. And in that case, we won't have adverse drug reaction occurring in our patients, and then we won't need additional treatment for such reactions. It will be cost saving because there's a reduction in inappropriate drug use. And also there will be reduction in drug-induced diseases. We all know that if we have to keep on monitoring when we're treating the patient, we incur more costs. If we have to do additional treatment for adverse drug reactions, we will incur more costs. And if we have issue of inappropriate drug use, we know what can happen. Complications can set in, and we'll need to treat the complication, and that will cost more. And then, of course, if we are not able to curb drug-induced diseases, there will be need to, treat drug-induced diseases, which is the additional cost. So when we have drug information services in place, we are actually doing some sort of cost saving for our patients, even for our facilities. Now, we look at pharmacists as educators of drug information. The pharmacist is supposed to provide drug information, and this drug information can be provided either on one-on-one basis or may even occur in more structured approach, whereby there could be presentations to a class of patients, maybe like diabetic patients or hypertensive patients, or even asthmatic patients, pregnant women during antenatal clinic. And it can also be information provided to a group of health practitioners like nurses in the practice facility. But in whatever the case may be, the pharmacist actually educates those who are the beneficiaries of this drug information. And when we want to provide drug information, we want to answer drug information questions, we use what is called systematic approach. And this systematic approach I will mention some introductory part of it. Like I said, to be dealt with into details when we are having our module 2 sometime this month, if not next, maybe 2 weeks time. Now, the systematic approach will involve getting background information. That is when a question comes in for drug information, you want to get more information concerning that particular question. You may want to get background information on the person who is requesting for information. You may want to know the name, you may want to know the affiliation of that requisitor, you may want to know the resources that that person has already consulted, because at times when you are providing drug information to a physician, it will be different for what you may provide for a nurse, it will be different for what you provide for even a patient or a patient carer. So we need to ask questions to be able to fine-tune the question so that we'll be able to assess the right information. Now, after asking background information about the concerning the dosage of the condition of the patient, for instance, if the patient is not alert, definitely the dosage form to be given to that patient will be different from a patient that is alert, that is ambulatory. Then after that, we now go into a search strategy. Of course, any pharmacist providing drug information should have good problem-solving skills so that it will be able to fully assess the situation. And that is where all those questions, background information, where they come in. So that I'll be able to define the exact, what exactly the question is about and how to provide the solution or information needed to suit that situation or to suit that patient. So after getting the background information, there's need to develop a search strategy, which we dealt with details in module 3. Then we evaluate the information that we have so that it fits to the question we want to answer, or we provide the correct information. Then we formulate and communicate a response, which requires communication skills and which will be dealt with in module 13. I hope we're still together, please.
Yes, ma'am. Yes, with you. Can you go on?
I don't want to disturb you are hearing me because my network is telling me unstable.
No.
Thank you very much.
Clear a lot, ma'am.
Now, when we're looking for information, we have different sources of information. We have what is called the primary source, secondary source, and tertiary source. These sources are quite different, and what we'll be able to get from them are different. For example, when we want to look for information through primary literature, this one consists of research studies, publications in journals. At times, even the studies may not actually be published in journal, but which you may come across either as a project in some departments, that is, these are original research coming from the researcher presenting the reports. That's first-hand report from the experiments, whether clinical trials or descriptive studies, but the report is coming directly from the researcher, and it's usually termed original research in journals. But like I said, it may not really be only in journals. You may check maybe thesis in the faculties or departments for your information. And I'm sure all of us will have carried out research at one point or the other, whether at undergraduate level, postgraduate level, or even West Africa. When we now publish this our reports, that becomes a primary literature, primary source. Then we have secondary source, which refers to references that have been condensed, that have been indexed, or where you have abstracts being collated from the primary literature. Usually, in this case, we can get information from index. This second literature actually refers us to the primary literature, but it has been compressed such that we just get maybe like the abstracts or summary But if we are now interested in getting the primary literature, we can now look for the actual reference to that abstract. Then the tertiary source is more compressed than the secondary source. In this case, when we're looking at tertiary source, it has combined a lot of things, especially when you're looking at textbook. Textbooks is an example of tertiary source of information. And also when we're looking at review articles or systematic review articles, these ones are compressed, they're like tertiary sources. So we can now look for the primary source if you are interested. But most times when we're looking for information, we can get what we want from the tertiary source and we can stop at that. But if we need more information, for instance, you want to carry out a study, you may want to look out for the primary literature where you can see maybe the method that has been used for that research you want to do. Somebody has done it before. Then you may start looking out for the primary literature. We'll now go to factors that may actually influence provision of information. I'm just going to look at two major factors. One is the ability to, the person providing information, the pharmacist in this case, should have the ability to perceive, assess, and evaluate information. And then the pharmacist should also keep abreast of advances in information technology. These days, you don't have to start looking, going to the lab, looking for textbook or journal. You just go online and then you get your information. But you have to be careful as to your source of information online. Like, I don't know if any of you are in my class talking about anti-malaria. I think it was, I was checking for information online and there was this reference that was calling Lonart. I think it was calling it the name of the company. I can't remember the name now. Instead of Lonart, it's calling it another name, which happens to be the company. So if I didn't check very well, I'll just present it to my student that this is the name, this is the brand name for that drug, which is wrong information. So when we are even searching for information, we should be able to search well and excuse me, search different sources so that we can get the correct information to the person requesting for information. Also, as much as possible, for instance, if we're looking for information concerning a particular drug, we should, as much as possible, look for information maybe from this. If the company has a website, for instance, the manufacturer, we can go to that site and check for that information. Now, skills that will be needed for answering drug information or answering questions for information. The person should have problem-solving skills and good communication skills. And when we're looking at problem-solving skills, it means that the person should have skill in critical thinking and decision-making, be creative, and should be able to process any information that is obtained before communicating to the requisitor. Just like I've explained before, that one has to be careful when you're looking for information, that's the right information through the right source, so that I can provide the right information to who is requesting for the information. And of course, there is need for good communication skills. Whether you are responding verbally or you are sending email, or you are writing it, you need to have good communication skills. Now we want to look at the skills needed for answering questions. Though I've mentioned part of this in, excuse me, when I was talking about systematic approach in slide 12, as pharmacists as educators of drug information. Now we'll be looking at this one by one to assess. And now in grammar will happen because this first bullet now is talking about assess available information and gather situational data needed to characterize the question. The next one is, you can see, your grammar not be my language. You can see access. So it depends on how you're going to pronounce it before the person knows what they're actually talking about. There are two different words describing two different things. So the second level is you assess the level of urgency or the details needed for that information. For instance, if the information needed is about poisoning, of course, that is urgent. You need to quickly get the information across. Then we need to formulate appropriate questions like that, those background questions that I mentioned earlier. Who is asking the question? For which patient? What is the status of the patient? Which will help you to formulate the appropriate answer once you're able to reformulate the questions appropriately. Then we use systematic approach to find the needed information. When you get the information, you evaluate the information critically for validity and applicability. This information that I have, does it suit this particular patient? Does it suit this particular situation? Which is a part of critical thinking. Sorry, problem solving skill. Excuse me. Then you develop, organize, and summarize the response for the question or the issue. You have to, you have different sources of information. You get different information. You need to now organize this information so that and summarize so as to provide the right information to the person who is requesting for the information. Then you communicate clearly. Your communication skill comes in here. And like I've mentioned earlier, whether you're writing or speaking, you need to communicate clearly so that, and it should be appropriate to the level of understanding of the person asking for the information. For instance, the way you're going to communicate the information to a physician will be different from the way you communicate information to a patient or a patient caregiver. After communication, we also anticipate whether there will be need for follow-up or there will be need for other information needs, so that you're just prepared just in case after providing the information and the requester is asking another question based on the information you have provided. Now, we all agree that the provision of drug information has evolved over a long period. Let's say in the past 60 years, it has evolved because there's shift in focus. The focus has shifted to development of safe and effective medication use policies and processes. Hence, this is one of the factors that is influencing the pharmacist's role as drug information provider. Now, some of these factors also include the fact that there's advancements in pharmacy informatics. Sorry, I think something is disturbing here. One moment, please. Excuse me. Then also focus is now on formulary management, and then we are now emphasizing on evidence-based practice. Of course, the issue of drug shortages, and we are practicing a new environment of care. So because of all this, we have to, our role has changed over the years as drug information provider. Then, of course, also when we consider the issue of medication safety, we're looking at adverse drug events. So in the past, pharmacies have been reporting or collecting and evaluating adverse drug events, but this has even increased due to the fact that there are new medications and new indications, and then we have growing elderly population. And when you have growing elderly population, it means, the elderly, usually they have multiple conditions which are treated by multiple medications. And this can lead to adverse drug events or adverse drug reactions because this population is growing. So we also have to, game up so that we can report all these adverse events properly. And then, of course, increased use of medications for disease prevention, then improve insurance coverage for medication, because the insurance company is not ready to just be paying for any adverse events. So we have to be sure that we are up in our game in preventing adverse drug event or adverse drug reaction. Because if you don't do it well, the insurance people can also refuse to pay. And of course, there's the issue of a sophistication of medication therapy. Two is a factor that has, led to increase in our provision of drug information over the years. Excuse me. So, and this sophistication of medication therapy has actually, given pharmacies or provide pharmacies with a more opportunity to, learn their expertise in assessing drug information needs of the healthcare professionals, patients, or family members. And it has also given us opportunity to provide literature to help choose the best medication to use within a class. And also it's helping us, giving us opportunity to convey the appropriate information to help patients correctly and safely so that they can use more potent medication safely. And of course, we need to address administration and delivery issues. Now we'll go to integration of technology, or which I will coin as information technology. When we're looking at information technology, it's all about hardware and software, which are used to create, store, or transmit, or manipulate and display information and data. So it's actually the in thing now. We are in the information age, and technology is rapidly moving, and we have to be tech savvy. And when we're looking at information technology as well, it encompasses the use of computers, network, computer software, and other electronic or digital devices for management and communication of information. And of course, IT affords remote site access to drug information. With your smartphone, your tablets, and the internet, of course, you can access information remotely. And then we should be able to combine this information and prepare the right information for our clients, whether healthcare professionals, patients, and the rest. So you must have the skill to perceive, assess, and evaluate information and apply the information to the situation on hand. With still on IT, with electronic medical records and other entry systems, we as information specialists should take leadership role in incorporating interventions and decision support, even at the point of prescribing. In some health facilities, everything is online. So as the lab result is coming, you can see it. As the physician is prescribing, you can see it. And if you think there's anything you need to put in, you need to intervene at that point. Drug information resources and apps. I've mentioned that we have our smartphone, tablets, which we can use to get information. Though the amount of literature is much larger, but because of our apps and the internet, we can manage even this large information, or the large amount of literature. And I'm sure as we're talking now, some of us may even be checking for some information. Maybe you want to provide information for somebody or something that I've said, and you feel, what Prof has said, is it right? Let me quickly check. Even in my class, I ask my students, oh yeah, bring out let's ask on Google for some information. Then let's just look briefly at pharmacy, what we call pharmacy informatics. It's actually information whereby the use of technology and automation is an integral part. And it actually helps us to organize, analyze, and manage and communicate information on medication use in patients. And then the specialist, the pharmacy informatics specialist, is an individual who has advanced information skills with keen understanding of computer and information technology. And of course, that is where we are now. Now, educating students on drug information concepts. Many areas have actually been identified as needed by drug information specialists. And these areas are actually incorporated into pharmacy curricula and taught to all pharmacy students. For instance, in my department at undergraduate level, we have a course we call PCL 501. I think we have changed it now to PCL 511, and it's called Literature Evaluation and Health Research. And some of the topics in that course include drug information sources, information retrieval, literature review / evaluation, communication and presentation skills, etc. Then at master's level too, we have a course, PCL 805, which is called Drug Management Information Systems / Documentation Techniques in Pharmacy. And some of the topics we have in this course include setting up drug information center, documentation / report writing, journal clubs, computer in pharmacy, etc. Now we have many practice opportunities for pharmacists in various settings, which include one, the health system pharmacies. In health system pharmacies, this actually involve managing of a formulary system, medication safety programs, medication usage evaluation, and even medication policy development and management. We can be leaders and we can have career opportunities in health system pharmacies, whereby we provide these services. Then also, we have practice opportunities in contract drug information centers. Actually, contract drug information center is fee paying. That is, if you want information from this contract drug information center, you pay certain fee for that information. But even then, the drug information, contract drug information center also has the responsibility for pharmacy services. For instance, drug information, even medication policy as part of the system. And most times they can be situated in faculty of pharmacy. They will have pharmacy informatics. The pharmacy informatics specialists actually support patient care activities by improving the efficiency of workflow, by increasing the specific information that is being provided. And of course, looking at, Then we have practice opportunities also in scientific writing and medical communication. And when we're looking at scientific writing, it's not the same thing as working in the pharmaceutical companies. It's more or less like working in an organization whereby medical education and communication is the major thing that they provide. They actually, in this situation, they provide education programming for healthcare professionals. Even they are involved in continuing education. And the pharmacists that work in these settings actually work closely with editors, graphic designers, website strategists. Even they work with meeting planners and scientists. They actually develop and produce medication-related materials. Then poison control. The pharmacists practicing in area that is involved with poison control actually practicing, they either practice in accredited poison information center or work at emergency room. The pharmaceutical industry, the pharmacists here actually will provide information even for others in that company. They prepare reports and monitor adverse drug events. They can also be involved in training others in the company, in the pharmaceutical industry. And they provide written information on the medication products usually by that company. Government practice opportunity even exists in governments. And in governments, this may include preparing medication use policies and procedure, improving the health system adverse drug reaction reporting, medication use evaluation programs, even preparing drug bulletins and newsletters. And when we're looking at working with governments, the example of US Food and Drug Administration, the pharmacist here actually is involved in providing regulatory guidance for drug development. They can serve as conduit for reporting drug problems, and are usually the first agency contact for whistleblowers. Then academia. In academia, we are involved in training of students, can be involved in designing curriculum, can be involved in teaching the drug information skills, and providing services even for the government and pharmaceutical industry. So in summary, we can say that all pharmacists must be effective drug information providers, regardless of where you're practicing. And of course, opportunities actually abound for pharmacists to use their drug information skills in all practice settings, either as a generalist or a specialist practitioner. Thank you. My references, I've mentioned this drug information, a guide for pharmacists, 7th edition, that has 30 modules or 30 chapters. The drug information, a guide for pharmacists, the 5th edition, the guides to University of Wisconsin.edu.n. Thank you. So at this point, I think there is room for question, contribution. Thank you, pharmacist Amolela, long time.
My prof, I salute you.
Good evening.
I have a contribution.
Yes, go ahead. Even in my undergraduate class, I always ask for contribution, not just question.
Prof will not give you everything. She will tell you to go and fetch yourself too. She will not feed you like a baby. Well done, ma.
Okay, we want to thank Prof for that detail. Hello, we want to thank Prof for that detailed, very insightful, educative, and very impactful lecture. We thank you so much, ma. You are able to define what the DIA is, the different activities, the skills needed, the services, and the benefits of those services, and the different information resources, and the career opportunities for people practicing drug information, and IT in DIA, equally pharmacy informatics. That's been very impactful for us today, and we have learned a lot from you, ma'am. Thank you so much for taking your time to prepare this lecture for us. We sincerely appreciate it. The time is now for questions and comments on the topic, the introduction to the concept of drug information. The floor is open. Okay, pharmacists, welcome. Your hand is up. You have the floor, please.
Thank you, sir. It was an exhaustive presentation, fully covered. Yeah, I know some time back, I think it's high time. Hello, my contribution. I think it's high time hospital pharmacists, head of hospital pharmacy, insist they want a particular pharmacist to be a drug information pharmacist in their department. It's high time we start putting measures in place, because here in the US, there's a course, a master's degree for pharmacy informatics. yeah, the pharmacist has a preliminary information, but they need a specialist, especially hospitals that are teaching hospitals. I believe there have to be guidelines now. We have to take the bull by the horns and showcase our profession, you know. Then two, I would suggest, I think we had this suggestion before, some of these online drug information centers where we can pay. Can't we pull 3-5 pharmacies together? You pay for this, we pay for this one, another group pays for another one, and we share the information. Thank you, sir.
Thank you for that contribution, and it is well noted. We welcome more comments and questions and contribution, please. Any other questions, any other contributions? Do you want to take it that we all understood everything that the Prof has given to us tonight? As you don't have any area I want to have clarification? We have many participants thanking Prof for that lecture where they delivered. Dr. Joe said, thank you, Prof, for the insights. Dr. Timmy said, thank you so much, Prof, for that insightful presentation. Your presentation was straightforward. Me, I saw it was detailed and everything, verbatim, clearly presented.
Thank you very much. And thank God that my network did not disappoint me this time. I've had cause to be switching between one device to the other. And at the end of the day, just be messing me up. So I really thank God that
Thank God.
that did not happen this evening.
And you are giving us the foundation of the training, and we hope to build on it. This is the module 1, it will be followed by module 2, and to be followed by module 3. We have about 30 different modules, and I believe as pharmacists wanting to be trained in drug commission, if we're able to go through this module, I'm very sure that we are going to become scholars, because these trainings are loaded. And our problem is that we are lazy. We don't want to. If you, our elder, can take your time to do this, I wonder what I wonder what we happen to us that we're not able to do more. So I want to really thank you for taking your time to prepare this for us, and we sincerely appreciate it. So, and next on the agenda, I think is the closing remark by the lead coordinator of pharmacies, Folashade Lawal. If she's on the call, can you go ahead to give the closing remark?
Okay, ready?
Okay, can you go ahead, ma'am? We want to have a closing remark by our lead coordinator of pharmacies, Folashade Lawal. Okay. In her absence, I want to call on the pharmacists. Are you with us? No, she's not. I want to call on the pharmacist Ojo, please, to give us the closing remarks on our behalf. Pharmacist Ojo, the chairman of the education committee, please.
Good evening, distinguished pharmacists on the call tonight. Thank you, Dr. Bello, the Deputy Coordinator for the Drug Information Specialist Group. Thank you so much to Professor Bolajoko for the insightful presentation. We appreciate you. And you made it so easy. It was as if we were in a level 101 or, 100 level pharmacy. I mean, there was nothing too complex about your presentation. It was very easy to just tip it in. Thank you so much for the reminder to our roles as drug information pharmacists. And thank you so much for other members of the profession on the call tonight. I hope that you have been able to have a lot of takeaways tonight like me. So let's go on and be specialists in our various areas of practice. Thank you very much, Ma. Thank you for the audience. Thank you for tonight. We appreciate you all.
Thank you, everybody. Have a blessed Sunday. Blessed time in the presence of the Lord service tomorrow.
Amen. So we have next on the agenda is the closing prayer. I want to call on the pharmacist Rukayat to give us a closing prayer. Rukayat, Adam. Yes.
Okay,
if you want to
Assalamu alaikum. Good evening, everyone. I'm prayers. We thank Allah subhanahu wa ta'ala, the Almighty, for making us to be alive, for making this presentation to be a successful one. We pray unto Him that whatever we have learned today, may He give us the grace and the ability to put it into practice, better the care of our patients and everyone around us. Oh Allah, unto you we've prayed, and we ask you that may you grant us more success in our forthcoming presentations. Amen.
Amen. Thank you for that.
Amen.
So at this, So at this point, I want to again thank us all for taking our time to be part of this very impactful and educative lecture, the first in 2024, and we thank you for that. So we also equally inviting us ahead for the next one, which is the module 2. And I hope those people that are in charge of that will start preparing for now and take care and learn from what the Prof just done tonight. So thank you all and good night.
Please, I have a question.
So, what's the question, ma?
I have a
What's the question, ma? What's the question?
The next module is supposed to be next week. Will it still be next week or 2 weeks' time? You know, because my own was missed for last week.
Okay. Maybe it will be 2 weeks' time. It will not be next week. So that we don't want to bother people with so the people in charge of that will look at it, but it may not have to be next week. So it will be upper week. So that people will have the time to prepare.
Okay.
And thank you, man. So the slides and
good night, everybody.
Good night.
Good night, everyone. Thank you, Ma, for the presentation.
Good night.
Good night.
Thank you. Bye.